Good morning, everyone. My name is Dolce Sharma. I'm working as a clinical instructor in RPIIT. Today, we'll discuss about the topic incontinence of urine. Urine incontinence. Anatomy of urine incontinence. The urinary system, also known as the renal system or urinary tract. Urine system consists of two kidney, two ureter, urinary bladder, and urethra. The purpose of urinary system is to eliminate waste from the body, regulate blood volume and blood pressure, controls level of electrolyte and metabolites, and regulate pH. Kidney are two in number located in left and right retroperitoneal space behind the peritoneum. Kidney are being shaped organ and as filter to blood to create urine and situated last thoracic and third lumbar vertebrae. Ureter. Ureter is a tube-like structure and attached to kidney and carries the urine to the bladder. Urinary bladder. It is a muscular sac in the pelvis. The bladder structure the urine, allowing urination to be frequent and controlled. Urethra. Urethra is the last part of urinary system and it eliminates the urine outside from the body. Definition. Urine incontinence is defined as the unintentional loss of urine, inability of the bladder to hold the urine due to loss of voluntary control over the urinary sphincter, resulting in involuntary passage of urine. Cause due to UTI, prostate cancer in male, hysterectomy in female, due to neurological disease, aging of bladder muscle, vaginal delivery can weaken the muscle need for bladder control. Symptoms: problem of controlling the urine, involuntary leakage of urine, especially when you cough or sneeze, frequent and sudden moderate amount of urine. Risk factor: menopause, age related change in the urinary tract, pregnancy and high impact exercise, being overweight and other disease. Types of urinary incontinence: stress incontinence, urge incontinence, overflow incontinence, neurogenic incontinence. Factors influencing urination: age. In the case of infants and children, they lack the voluntary control over the bladder because they do not have well developed urinary system, but individuals have voluntary control over the maturation. Diet: fluid intake. Food and fluid that are rich in caffeine and alcohol increase the urine output. Exercise: it enhances the muscle tone, which leads to gallbladder contractions and healthy elimination. Medication: certain medication like diuretics increase the urine output. Continue. Environment: clients experience incontinence generally during what? Psychological factor: anxiety, emotional stress, increased frequency of urination, disease condition. Many diseases affect the ability to maturate. Example: diabetic mellitus. Other conditions: in case of the pregnancy, due to increase the size of uterus, can exert pressure on the bladder. Pathophysiology of urinary incontinence. Incontinence of the bladder occur when those pelvic muscles that involve in urination get traumatized, either overstretched or tear that leads to weakness of the muscle. As the goes by, the muscle become weaker until at certain point they cannot support the bladder anymore. When there is high pressure from the abdominal, such as coughing, sneezing, lifting, or pushing heavy things, the bladder forces urine to pass the urethral sphincter, causing incontinence to occur. Clinical manifestation: sensory sign, odor of urine or feces in the room, soiling of undergarments or bed linen, irritation perineal area, accidents while engaged in physical activity and sneezing. Emotional sign: anger, decline in social activity, desire for attention. Diagnostic evaluation: physical examination, no identify pelvic muscle prolapse, urine analysis, urine culture, no identify infection, spinal MRI, ultrasonography, hysterourethropy, vaginal examination, pap test, assessment. Carefully assess environmental factors for the potential impact on the urinary incontinence. Dietary habits such as exercise, caffeine intake, or insufficient fluid intake. Physical examination and specific diagnostic tests also aid in identifying urine incontinence. The PV or post-voidal residual can be measured by the use of portable ultrasound device that scan the bladder. Management: medical management, pessary. It is a prosthetic device that can be inserted into the vagina. It supports internal structure, often used in case of urinary incontinence and a vaginal and a pelvic organ prolapse. Urinary seal: strong, flexible, adhesive, creates a positive seal with urinal. It is made up of flexible PVC and move with urinal. Urinary insert: small plugs inserted in urethra to prevent urinary incontinence. Condom catheters: it fits over the penis or vagina. It is connected to the urobag for urine. Urinary catheters and urobag. Urinary catheter is a hollow flexible to be inserted into the bladder through urethra and connected to urobag. It collects urine. Pharmacology therapy. Anti-cholinergic agents like oxybutynin, diclomyramine to inhibit detrusor muscle contractions. Tricyclic antidepressants like empramine, doxepin, estrogen, calcium channel blockers. Management, surgical management. Surgical procedure involves lifting and stabilizing bladder or urethral vesicle angle. Pre-urethral bulking is also done, and this agent, like artificial collagen, is injected in the urethral wall to close urethral opening. Nursing management, a number of measures can be employed to help reduce the problem of incontinence. Formulate a schedule and define definite timing for the patient and try to empty the bladder. Use toilet or commode and use or not to void. Instruct the patient to drink a major amount of fluid at regular intervals. Perineal exercise. These exercises and the tone of perineal and abdominal muscle, periodic tightening of the perineal muscle, intentionally shopping and then starting the urine system, etc., can help in gaining voiding control. Arrange for the toilets or bedpan within easy reach of the patient, as delay in responding is a common sense of cause of incontinence. Bladder training program. Any exercise program started to strengthen the involved muscle. The patient is placed on the commode or toilet every 2 hours, depending on the frequency of maturation. The interval are lengthened as the program. Skin care should be done to prevent infection. Complication skin problem, rashes, skin infection, sores can develop from constantly wet skin. Urinary tract infection, incontinence, increase risk of repeated urinary infection. Impact on personal life. Urinary incontinence can affect social work and personal relationships. Thank you.